Good afternoon, everyone. This is Darlene with Generations Help. And on behalf of Leslie Katz and the Loudoun County Area Agency on Aging, I'd like to welcome you to our caregiver education program, Caregiving from a Distance During a Health Crisis, presented by Jennifer L. FitzPatrick. Before we get started, there's just a couple things I need to cover with you. The first is everyone is going to be muted throughout the entire program, and that is simply to eliminate any background noise. However, this is an interactive program, so we do encourage you to ask questions, to answer questions, or if you have any comments about the discussion that is taking place, please feel free to communicate with us, and you can do so by utilizing the chat feature. As a reminder, to find chat, if you scroll across the bottom of your screen, you're going to see a little bubble that pops up, and on it says chat. When you click on it, it will launch the chat feature, and it will most likely pull up on the right-hand side of your screen. Now, when you use chat with us today, those questions, comments, answers, those are only going to be seen by Leslie, Jennifer, our presenter, and by me, and that is really for privacy reasons. But Jen is great about going through chat and making sure that all of your questions and comments are addressed. As I mentioned, we are grateful to have Loudoun County Area Agency on Aging sponsoring today's program. And if you have any questions about services and programs offered, please feel free to send an email to aaa support@loudoun.gov. The staff are there for you as you navigate your caregiving journey. And in the chat, you'll notice that the email as well as a phone as well as a telephone number are also included for you to reach out. All right, now, has the pandemic and COVID-19 policy increased your stress as a caregiver? If so, this program today was especially created for you. Our presenter is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University's Certificate on Aging program. She is one of less than 800 certified speaking professionals worldwide and has been featured in national media such as The Wall Street Journal, Reader's Digest, SiriusXM, CBS, ABC, and many more. When she's not working, she spends her time as a below average first mate on her boat. Please join me in welcoming from Kent Island, Maryland, Jennifer L. FitzPatrick, MSW, LCSW-C, CSP.
Thank you, Darlene, and thank you again to Leslie and the Loudoun County Area Agency on Aging for hosting this program today, and we sincerely mean it. If you have a question, if you have a comment, if there's anything you want to delve into further, we want to try to get as specific as possible to help you during this incredibly challenging time. So feel free to write in, use that chat section. If you want to vent, if you want to ask questions, you have comments. We know that there's a lot going on right now, and we really want this to be tailored as much as possible to those of you who are joining us live. And for those of you who are joining us from the recorded version, we hope you enjoy the questions and comments that others are sharing, because a lot of times if you have a question, somebody else does as well. What are we dealing with right now? A year ago, I will tell you, I had never heard the term social distancing. I remember in March of last year, I was joking around with my team. We were trying to get some levity. Everybody was stressed. Everybody was nervous. Everybody was scared. We're hearing potentially 5% of the population is going to die from COVID-19. It was a very, very scary time. Everything was shutting down. And I said to my team, gosh, what do you hear more frequently, social distancing or abundance of caution? And I would say that social distancing stuck. That term is definitely one that we hear all the time. When we were told to stay home for 2 weeks about a year ago, at least in the DC, Maryland, DC, Baltimore area, Northern Virginia, we thought 2 weeks, okay. It was all about flattening the curve. We're going on a year later. And the thing that's fascinating to me about what we're experiencing is that we don't have a complete end in sight. And that can be really tough. When someone tells you you have to do something for 2 weeks, maybe stay home, try to avoid other people, maybe wear a mask, maybe not see your grandkids, or maybe not see your elderly parents. okay, well, that we feel like, well, we can handle it. When you don't know when the end is coming, it reminds me a lot of caregiving itself. Now, so for example, back when I was in my early 20s, my grandmother fell forward and broke both of her shoulders. And for 4 weeks, her doctor told her for 4 weeks, you're not going to be able to use your shoulders. We have to immobilize you. And so she wasn't, think about all that you do with both arms, both hands, both shoulders. She wasn't able to feed herself. She wasn't able to drink. She wasn't able to use the bathroom or wash herself. And so my aunts and I committed right then and there that we were going to be her hands and her arms and her shoulders for 4 weeks. But we knew that there was an end date in sight. And so for a lot of us, even though we were really scared a year ago, many of us were really anxious, really scared, really worried. A lot of us felt like, all right, it's 2 weeks. But right now, what's happening is very similar to a long-term caregiving situation, say with someone that has Alzheimer's disease. And you're starting to take care of that person, and it could be a year, it could be 3 years, it could be 10 years of caregiving. You don't know what's in store for you. And I think that's one of the reasons that so many of us are still finding ourselves incredibly stressed out, because we don't know when some of the restrictions are going to change, when there's going to be more of a normalcy happening in our lives. And so it can make this already difficult time even more stressful, even more anxiety provoking. Is there a light at the end of the tunnel? So a lot of us are feeling really good because there's a vaccine, there's several vaccines, and that but there seems to be, in a lot of cases, chaos. How do we get the vaccine? Who's at the top of the line for the vaccine? Do you still have to social distance when you vaccine? One of the strategies a lot of senior living communities are using to try to excite people about the idea of going to assisted living is that you automatically get the vaccine when you go to a senior living community. So that can be a very good thing for a lot of people who have decided that senior living is a good thing for them right now. But for some of us, we feel like it's the light at the end of the tunnel, but still we don't have a date when, okay, we're going to be told things are normal. Everything goes back to normal. So whatever your situation is right now, you probably feel like you're in a little bit of a limbo. Maybe you're not sure if you should be changing the way you're doing caregiving, or if you should be looking at trying to expand the services that you're using in caregiving, because maybe you're a little bit afraid to use maybe a home care agency, or maybe you've gotten over that. You said, well, if we don't know how long this social distancing and this whole new normal is going to be going on, maybe I should just go and utilize a home care agency. So we're going to talk about all that, because especially when you're at a distance from your loved one, and a distance can mean that your loved one lives 3 miles away from you, but you don't see them right now because of social distancing. Maybe your loved one is really, really high risk. Maybe you're really, really high risk, and you just don't feel like you want to risk really being in the same area with that person. Or in some cases, it might be that you're here in Northern Virginia and your loved one lives in California, and you don't want to get on a plane, or you don't want that to bring them closer to you. So long distance caregiving right now can actually mean a lot of different things, and it includes a lot more caregivers than ever has previously. So what I'd like to ask everybody to do is I want to invite you to tell me where your stress level is. And I don't want you to just be thinking about caregiving, okay? I want you to be thinking about whatever stress is going on in your life, whether it's the stress that you're dealing with about your job. Maybe you have to work from home, and maybe you have a child that's doing online learning. And then you've got a parent that's in a senior living community that you don't want to visit because you feel like it'll be too risky. Or maybe you're trying to figure out how to navigate going and visiting your loved one safely. So whatever is going on in your life, whether it's work, whether it's the caregiving aspect, whether it's family issues like homeschooling children, or trying to get used to being at home all the time with your spouse, who maybe both of you used to travel, want you to pick out, where do you feel like your stress level is? Are you more low? Oh, sorry, very stressed. So very stressed would be a 0. And that would be actually, we're going to say 0 to 30 is very stressed, that you can't take any more stress. And we're going to say 100 is there's no stress at all in your life. So where are you? Where is your stress level? So I'm gonna give everybody a moment, and Darlene's gonna tally us up and let us know where would you put your stress level? 0 again being very stressed and 100 being not so stressed. So most people are saying they're on the lower end, which is great. So 70 to 100. So I've been teaching college this is my 20th year of teaching college. And so if you get a 70, 80, 90, so 70 would be passing. So your stress level is sort of at passing. And then those of you who are at 100, you're at an A plus. You're not experiencing any stress at all. So those of you who are 0 to 30, you're very, very stressed. And there's a big group of you that are in the middle. So about a third of you are saying you're between that 30 and 70. That's not really a passing grade. So for about half of you, we really want to reduce your stress level. We want to figure out what are ways we can do to reduce your stress level. About half of you are not so stressed, and the other half of you are pretty up there with stress. So if your stress level if you would say that you're at a 60 or below, then we really want to be looking at today. What is one small step that you can take, whether it be today or in the next day or two, to reduce your stress? And for those of you who have indicated that, yeah, you think maybe some people misunderstood the scale. Okay, so we're gonna do. Actually, we're gonna go ahead and do one more. And so again, I want 0 is very stressed, and then 100 is not so stressed. So we're gonna do it again, but I want you to be thinking about your loved one. So if your loved one, the one that you're caring for, is maybe living in a senior living community, another part of town, or maybe they live across country and you have a sister that's taking care of them, or perhaps maybe they live with you. Where would you put their stress level? Would you say it's similar to yours, or would you say it's different? So everybody rate where and maybe it's your husband that you're taking care of. Maybe your husband just had a stroke and you're taking care of him. Where would you say his stress level is? So we'll give you all a couple moments and Darlene will tally everybody up. Okay, so most people would say their loved one is in the middle. Some are saying really low stress level and some are saying really high. A lot of us as family caregivers really focus on, we are doing the navigating, trying to figure out services, trying to figure out financial issues as it relates to taking care of the loved one. And sometimes we forget that being the recipient of care, especially if the person who we rely on, whether it's a daughter, whether it's a nephew, whether it's a grandchild, is not with us all the time. If we don't live together, it can be really stressful. Is my loved one going to be able to visit me? Are they going to be able to get me the supplies that I need? Maybe medication, maybe food. What if I fall? What if I need to go to senior living and we can't afford it? So most of you are saying you would say your loved one is in that 30 to 70 range, which is a very high level of stress. And some would even say higher. Okay, so since I want to, we pull up this poll, before we pull up the poll, actually, just hang on for a moment. Thanks, Darlene. I want to talk to you a little bit about the difficult feelings that you're experiencing right now. Now, I've done this poll many, many times since last March, for the last 11 and a half months. And it's interesting to me that most people are having difficult feelings because of the pandemic. But some people are having difficult feelings, maybe not just because of the pandemic, but because of COVID policy. Now, let me give you an example. In the last 6 months, I've heard countless stories of people who have had to go to the hospital or who have had to go to a procedure that they couldn't bring a loved one with them. And so I'm going to give you a story of some friends of ours. I'll call them Joe and Sarah. And Sarah needed to go to the emergency department. And Sarah went to the emergency department. Her husband, Joe, drove her. And she got to the hospital. They said, we're going to keep you. She texts her husband, go home. They're not going to let you in. She gets admitted. And the long and the short of it is eventually Sarah gets into a hospital room and Joe talks to her a couple times and Joe's really stressed out. He's nervous. He's worried. Sarah's sitting in her hospital room, lonely, feeling kind of afraid and frustrated because she can't have her husband with her. She's nervous. She feels sort of helpless. Joe feels helpless. He's stuck at home. What under normal circumstances, Joe would be at the hospital. Their adult kids would be at the hospital. Probably their grandkids would be at the hospital too. And so at one point, Joe called Sarah's cell phone and she didn't answer. And then he called the nurse's station and he said to the nurse, hey, listen, I'm trying to find my wife and she's not answering her cell phone. She's not answering the phone in the room. What's going on? Can you tell me? And the nurse said, well, you have to give me the patient code or I can't tell you what's going on with your wife. I can't even acknowledge that she's a patient here. And Joe said, you're kidding me. I don't know anything about a patient code. My wife was just admitted. And you probably all have, we've all been in a situation when someone we love is in the hospital and you're not right there with them and you can't get hold of them. Your mind starts panicking sometimes. We know most of the time that what's happening is they're probably getting tests done or something of that nature. But it was very intimidating and scary. The point that I'm trying to make is the difficult feelings that Sarah and Joe were having when they experienced this was not because of the pandemic. It was because of COVID policy. Because right now that most hospitals are not allowing a family caregiver to come in. And so a lot of us in that situation, even though Joe and Sarah live together, they're married for 45 years, Joe's a long distance caregiver because he is not by her side. So for those of you who might not even identify as a long distance caregiver, you might be experiencing some of the feelings because you're being separated from your loved one. Maybe because of visitation policies at senior living and social distancing and other issues like that. So now I'm going to ask Darlene to pull up the poll. And I want you to tell us what difficult feelings have you experienced most due to the changes because of the pandemic and COVID-19 policies. And you can pick all that apply. And if none of them apply to you, then you don't have to click on anything. But if any of these have applied to you, or maybe all of them have applied to you in the last 11 months, feel free to click on any of them. Give Darlene a few moments to tally us up. And if anybody wants to share any of their specific examples, so almost 70% of you have said you've had feelings of fear, nervousness, tension. About 70% of you have said you felt frustrated. About 40% have said they felt lonely or isolated. About 40% said you feel distrustful and skeptical. And then about a third of you are saying helpless and powerless, overwhelmed, stressed out, burned out. And then about a third of you are saying sad and unhappy. And then a little bit less are saying hopeless, despair, anger, resentment, confusion. Okay, so thank you, everybody. If anyone wants to elaborate or give more details, feel free to jump in right in on the chat section. I want to finish the story about Sarah and Joe. So Joe suddenly is this long distance caregiver, even though it's his wife, even though they live together, even though they've been together forever. And he's experiencing a lot of the challenges of a long distance caregiver. And so many of you, even if you live with that person, it might be that you're having moments like that. And sadly, Joe was angry and upset with the hospital and at the policy. And Sarah was lonely and nervous being in the hospital by herself. And when Joe got hold of Sarah finally by phone, she says, "What's the matter with you? I was out having tests, everything's fine." And they wound up getting into a little bit of an argument. And Joe's like, "You had me so worried. Why didn't you give me the patient code?" And Sarah says, "I didn't even know there was a patient code." And so what I'm trying to say here is that it's not just the pandemic. It's not just COVID-19. It's COVID-19 policies that can be causing a lot of strife for you as a caregiver right now. So it's so important to be managing your feelings. And the last thing that either one of them wanted right at that moment was to be in an argument about the goofy hospital patient code. But it was just a very stressful time. Under normal circumstances, Joe would have been right by her side, holding her hand, probably sleeping in a chair in that hospital room. What can you do now? So if you indicated that you've been feeling difficult feelings during this last 11, 12 months, allow yourself the opportunity to vent and express yourself. And right now, I want everyone to feel comfortable. All the responses only go to Darlene and Leslie and myself. But if you want to vent about anything that's going on right now, about how you're upset or frustrated or feeling isolated, maybe because some of your coping mechanisms have been taken away from you during this time, you're really frustrated. Maybe you had an in-person support group that you look forward to. And after support group, maybe you had somebody at that support group that you really looked forward to seeing each week, and maybe you would grab coffee afterward. And maybe you're really angry or frustrated that you don't have that opportunity right now. Or maybe you're having a really hard time. Maybe at the community where your loved one is, they're really limiting visitation, or they making it only outside, and with all the lousy weather, it's been too difficult for your loved one to navigate being outside. Or maybe you're very anxious. Maybe you feel like the community where your loved one isn't doing enough to keep everybody safe. So allow yourself the opportunity to vent, whether it's right now in the chat section to me and to Leslie and to Darlene, or whether it's to a friend, or whether you do an online support group where you can vent and talk about the challenges that you are facing right now. So think about that and allow yourself to feel the feelings and vent. Think about what's no longer working for you and your family. What's no longer working for you and your family? So maybe there's a situation where your loved one was going to adult day. So one example that was really important early on, that I spent some time with a family caregiver talking about the issue of the loved one being in adult day all day, and it was going really, really well. And this person was able to keep mom at home long term because she went to work every day and her mom was going to the adult day. Well, all of a sudden, everything, life as we know it, came to a screeching halt. And all of a sudden, mom, who has dementia, is home all day, and the daughter is home all day, also working. And the daughter is saying to herself, I was able to do this for over a year, keep my mom home by sending her to adult day. And about every month or 6 weeks, one of her other sisters would come in from out of town and stay with mom so she could get a break. So she could go away for the weekend with her boyfriend. So she could maybe, even if she went out for lunch with friends, that she didn't have to do everything for mom. She didn't have to help mom in the bathroom. She had adult day, and then every 4 to 6 weeks, she had a long distance family member, a sister, come in from out of town. And that all changed. And for this family, what they had to be thinking about is this situation's no longer working for us. And it was time for them to think about, is senior living the right option? Or maybe since mom's going to be home with me all day and I have to get my work done on my computer, maybe it's time for us to look at home care. Or maybe it's time for us to look at friends and neighbors who we trust that are going to be really careful, or maybe get COVID tests to help out with mom, because the situation with my sister coming in from out of town every couple of weeks isn't really going to work anymore. So during this crisis, this has been a very upsetting, challenging, scary time for so many of us. But what it has shed light on is, and I know that a lot of us have, even though that this has been a really dark, difficult time, a lot of us are seeing some silver linings. And one thing might be that you're going to be able to see really clearly what's no longer working for you and your family. Is what you have in place working well? So a couple people writing in the chat. So, okay. So we've got somebody writing in, says, had difficulty sleeping during the pandemic with strange, vivid dreams, unable to visit your 85-year-old mom who lives in Texas alone, not been able to spend time with kids and grandkids, easier to cope when the weather was nice and we could visit outdoors. Yeah, absolutely. A lot of people, and it's interesting, it's different in this part of the country. There are parts of the country where maybe Florida, where people are outside this time of year and people probably wouldn't be able to relate to that as much. And I'm sure right now, with the person who just said this, with what's going on in Texas with the power and everything, that must have been even more and more stressful and scary for you. So I thank you for sharing that. And no, you're not by yourself. And a lot of times, sometimes when you have those strange and vivid dreams, it is your brain's way of trying to work out the stress that you're dealing with. And but it can be, I know that for me, I'll just share, when I have crazy dreams like that, I know that I feel like I was running around all night. I feel like I didn't even sleep. I was so busy in my dreams running around. So it can be really tough. So I would can encourage you, maybe talk to your doctor about that, what maybe you can do. And I know that some of what I'm about to say, you might say, yes, that's I call it the boring advice nobody wants to hear, but it might be helpful to look at your diet, your caffeine intake. It might be helpful to look at, can you exercise a little bit more? I'm not saying that this is your fault at all, but sometimes there are things that we can do to maybe get a little bit better sleep. But I think one of the things that we need to be doing is thinking about what makes sense based on our own risk tolerance. And so one example that I just want to share is, especially young children, the data, there's a lot of data that says that little kids, and I don't mean college age kids, but small children tend to not get, if they get COVID, they don't get they don't tend to be super spreaders. There's a lot of data to support that. So it might be that the person that just wrote in, maybe that if you have tiny grandchildren, little ones, I'm not saying 18-year-olds because they tend to spread COVID, but that maybe you can actually spend some time with your 7-year-old grandchildren and your 9-year-old grandchildren. And again, everyone has to think about that, talk to their own doctor, determine what your risk tolerance is. Everyone, you got to always make your own choices based on what you and your doctor feel is right for you. But you may want to weigh some of those mental health pieces of what would be better for you. Maybe one thing I know a lot of families are doing is they're investing in those big heat lamps like restaurants have to sit outside, maybe putting them on your deck, putting them on your porch, putting them so maybe you can have sort of a distance visit with your family, your friends, your neighbors. Or even maybe, and again, another one, and I'm not saying that this is the perfect solution for our area, the Mid-Atlantic, but investing in better winter clothes and heavier duty, maybe taking long walks with your neighbors when it's not icy and snowy out, but being able to get out there and take a brisk walk, and that might help with sleep as well. So we've got somebody else writing in. Your loved one is an elderly person, depressed, and she won't see, I guess, me. She suffers from insomnia and most of her time is in bed, but she's not sick. She talks on the phone with her cousins via WhatsApp, but her home is in disarray. We can't get someone to help her because of COVID. She won't pay attention to doctors' suggestions. I work, my sister works. We can't help as much as we could. We drive her around, but it's frustrating. I recommend, if your loved one that you're talking about has depression and they have capacity, they're able to make their own choices. They don't have dementia. They're not cognitively impaired. I think you're doing the right thing, talking to them about speaking to the doctor. And there are ways that potentially, listen, life is not a zero risk game. If you bring help into the home to clean, or if you bring help into the home to help with chores, yes, there's going to be risk. There's going to be risk, but sometimes I think everybody has to do that cost benefit analysis. But if your loved one is depressed and she's really anxious about COVID, it might be that it's time to talk to her maybe about moving to senior living where she could get the vaccine, and that it might be that she would have more social interaction and she would have somebody keeping an eye on her depression. But one thing I will say about that, and it's really, really tough, is that when someone's cognitively intact and they have depression, we can make suggestions, we can offer solutions and ideas, but you can't make somebody do anything. In Cruising Through Caregiving, my book, I write a whole chapter on your older loved one is an adult. That person's a grown up. They are not they're not there, they're not a child. And sometimes we want to, I know it's funny, I have a lot of social work students this semester, and one of the things that we talk to them about is that you can't force adults to do things. You can't force people. And so there are going to be times when I think one of my students recently said, oh gosh, wouldn't you want to just shake that person and tell them, this is not the right way to do it. But we wouldn't want someone doing that to us. So in Cruising Through Caregiving, my book is Cruising Through Caregiving. Someone's asking for the title. If Darlene can put that in the chat section. And if you go to cruisingthroughcaregiving.com, you can get a free chapter of the book and all the worksheets if you would like. But pardon me. But I think it's really, one of the things is to keep at it, to be persistent, to not be a nag. Don't be constantly bugging her, but remind her once in a while. Look for natural openings. Maybe you have a friend whose mom recently was very stressed about letting some help into the home, but she finally relented after she got the vaccine. Or maybe she decided she was going to move to senior living. That way she would have more socialization. But ultimately, and this is a really tough part of being a family caregiver, especially for someone who doesn't have cognitive impairment, is they do ultimately get to make decisions that we don't necessarily agree with. So feel free to keep writing in if you want. But what you can do, for those of you who are feeling like you're ready to tear your hair out and mom's not, or Aunt Sue isn't doing what we want her to do, you can acknowledge, while your loved one has every right to not go along with what your suggestions are to be mentally healthier or physically healthier, you also have the right to pull back. And especially when you have a loved one who isn't cognitively impaired, and if they want you over there every day dropping meals off, you might be saying, that's not working for us and our family anymore. We have so much going on with homeschooling the children that we can only drop off meals twice a week, but maybe you could get delivery, or maybe we can get other friends and family members to drop off meals. And this is something that I think is really important that long distance caregivers can do. So maybe if you have siblings, or maybe you're not local, you really are a distance caregiver. It's an hour or a 5 hour or a plane ride to get to your loved one. Maybe a way that you can contribute, rather than flying in every 6 weeks or every couple months or what have you, is maybe you get coupons for DoorDash or for Uber Eats, or maybe you arrange for some type of meal delivery service that can help the caregivers or the people that have boots on the ground in the town where the loved one resides. So that's a way maybe that you can contribute if you can't be there in person. So what else can you do now? If, let's say your loved one does have cognitive disorder though, and I'm guessing some of you do have a loved one. So what do you recommend? How much information right now? Maybe let's say your loved one is in a memory care community and you really aren't able to visit them much right now because of what's going on, because of whether it's your risk factors or theirs, or if it's the assisted living community's policies. And they want to know why. Why can't you visit? How much information? What do you think is the right way to handle this? So what do we think? Tell them basic info, tell them very little, just tell them everything. Tell them, hey, there's a global pandemic and all these people have passed away, and especially older adults with a lot of advanced conditions. What do you think is the best way to manage when someone's got a memory issue? So most of you are saying just be basic, don't go into too much detail. And I have to say, especially if the loved one has advanced dementia, I think using terms, do you remember the first time you heard the term pandemic as it related to COVID-19? A lot of us were really freaked out. I know that I was. Oh my gosh, a pandemic. It sounds really scary. And so, especially if you have memory impairment, and it's funny, and I don't know about any of you, feel free to write in what your thoughts are, but I know right now I'm like, oh yeah, the pandemic. Like it's like we've heard the word every single day, multiple times for almost a year. But if you have Alzheimer's or Lewy body or another type of dementia, and you keep hearing from your daughter who lives in, say, maybe you live in DC and your mom lives in Texas, and you're saying, and if she has Alzheimer's and you're saying, Mom, I can't visit, there's a pandemic, people are dying, and she has Alzheimer's, if she hears that over and over and over again, it can be very agitating. And I have heard from so many memory care communities that the older persons in the communities are usually doing much better than the families. They're engaged in activities and programming, and the staff are properly trained. But when families call up or families FaceTime and they say, oh my gosh, did you watch the news? Did you see what happened today? Did you see this? And it can be very alarming. And this is not to say, listen, if someone's in the early stages of Alzheimer's, you can share more most likely, and you can be a little bit more detailed, but you want to just be super, super careful about what I think a lot of long distance caregivers tend to do, and they don't do it intentionally, but they feel so bad that they're not with their loved one, or they're not visiting as much, or they're not maybe dropping off as much, or that they want to justify it. And it's not because they're trying to make things difficult for their mom, but they just want mom to know, hey, I didn't forget about you. And so you want to handle it in different ways. You want to keep in touch with mom, but just be careful about getting too detailed about why you're maybe not there in person like you might be normally. So important to take care of yourself and for your loved one to take care of yourself during this time. So and all of that, what I'd like to ask everybody to do before we get into what can you do to stay connected during a healthcare crisis, I would like to ask, what are you doing for self-care during this time? Have you created any new habits? What's been something that's been really good for you that has worked? Because some of you have indicated that you have low stress levels. Your stress levels are not off the charts. They're not as bad as other people. So I'm wondering if those of you who have lower stress levels, what have you done to maintain self-care? And we've got a couple people writing coloring. I bought myself a Headspace subscription. It helps a lot. So I've actually done that as well, working out, exercising. So I've done that. I've purchased a lot of meditative products during this. I've done a lot of free yoga classes on Amazon. And I have to tell you, I'm one of the worst yogis. I am horrible at yoga. I'm not good. I'm terrible, terribly uncoordinated. But having a silver linings list has really helped me. Wireless headphones that are noise canceling with Audible books. Okay. So some of you, I think having some kind of doing webinars like these, I've coped a lot in the same way. But a lot of us listen, life is not meant to be lived on Zoom or in webinars. We have got to go back to being around people and in normal at some point. But for right now, doing that yoga class on Amazon for free, Amazon Prime, or doing a webinar like this, I'm hoping so soon I will be able to see all of you in person. But right now, if you can get information, if you can engage with others in this way, this is good for your mental health. For all of us, whether it's you, whether it's your loved one, engaging is so protective against mental health problems and physical health problems. And so I keep bringing up this cost benefit analysis. Listen, if you're 95 and you haven't gotten the vaccine and you have all these different health conditions, you really want to be careful. And I'm not saying that, listen, we know people who are 30 who have been very, very, very sick with COVID. But I think we all have to be making decisions about, okay, what is a reasonable risk? Is taking a walk outside with neighbors, Yeah, if we're going to keep ourselves 6 feet apart, is that a good risk, or is that worthwhile? Would that be good for my mental health and my physical health? So everyone, but having more contacts, and I don't necessarily mean in-person contacts, but some engagement, just being on this webinar today is good for you. It's good for your brain, and it's actually good for your body. Working out, like you said, coloring, but doing something where you're engaging with others, whether it's an online support group, whether you're taking an online class. So I love to hear all of these coping mechanisms. And again, life is not meant to be lived on Zoom, but in the meantime, until you can go to an in-person support group or an in-person exercise class, sometimes that's the way to go. So how do we want to engage with our loved one if we're at a distance? So don't underestimate notes and letters and cards. I opened my mail today and I got a save the date for a wedding, and I got a thank you note. I actually got 3 pieces of mail that were not bills or invoices. And it was just a miracle day, because how often do you have that happen? Not very often. And so when we open up the mail and there's a card, a thank you note, a just thinking of you note, anything like that, even if it's just a little message from somebody, it really does make a difference. And remember, the oldest generations especially appreciate that. They appreciate that. There's been lots and lots of data that debunks. Remember when all of this started a year ago? Oh, it could be on surfaces for days. There's a lot of data that suggests that your mail is pretty safe. So consider, can you engage with others? And maybe you're sending a couple of cards a day, or sorry, a couple of cards a month to your loved one. I'm thinking of you. I love you. These are pictures I found of us from a couple years ago. Those are ways to keep connected and keep that social engagement going. Virtual visits and gatherings. So in the beginning of the pandemic, I felt like every night of the week, not only was I on Zoom all day, as Darlene can tell you, and I'm sure most of you, if you have a job, or you probably were on Zoom all day, every day, but then you turn off the Zoom during the day, and the evening you're doing Skypes, and everybody was virtually gathering, virtual coffees, virtual happy hours, virtual trivia. I have some family that are doing virtual trivia on a monthly basis. So this, to me, one of the silver linings that I thought of during this pandemic was there was a period of time for, I want to say 8 or 10 weeks, where my husband's high school friends were doing a Zoom every Wednesday night. And this is people from all over the country that would not be engaging with each other on a weekly basis. They never would have done that if everybody wasn't working from home. And again, I'm not saying life should be lived on Zoom, but Skype, FaceTime, all of that, even if you just do a quick FaceTime to say hi to your loved one, I know it's not the same as being in person. Believe me, I'm not trying to tell you the sky is red when the sky is blue, but it's something. It's a way to have those engagements. The more social engagement that we have, the more social contacts we have with others, the better it is for our physical and our mental health, and it reduces loneliness and isolation. Phone calls. Now, especially for our oldest old, I know we're trying to get everybody on Zoom and FaceTime and Skype, and all that's terrific. It's wonderful, and we're so blessed to have that technology. But especially the oldest adults, they sometimes really just want to talk on the phone. They don't need to see your face. Maybe they're running around in their bathrobe, and they just want you to call. Now that said, I think it's great. Now, I'll go back to virtual visits and gatherings. Back when the pandemic began, my husband's family was going to do a virtual gathering, and my mother-in-law, who's 78, did not know how to use Zoom. And so my husband called her, and in 15 minutes, she had downloaded the Zoom app to her iPad, and now she's using it to do her own gatherings with her friends. So I'm not saying that older adults don't enjoy that or won't enjoy that. You know that a lot of them, they love it. But sometimes a simple phone call will suffice. Don't underestimate the power of a simple phone call. Now, back in the beginning of the pandemic, I have a colleague who was telling me she was calling her mother 3-4 times a day. And I said, why? And I said, and her mother lived at a distance in a different state. I said, why are you calling her 3 or 4 times a day? Do you do that normally? And she says, well, no. And I said, what are you doing? Why are you breaking with what you typically do? Well, I can't be there in person. Well, would you be there in person 3 or 4 times a day, every day? I said, how often do you usually call? She goes, usually 4 or 5 times a week. But it was her tension, it was her nervousness. So sometimes too many phone calls might not be good for either of you. And her constant checking in on her mother was making her mother nervous, and it was making her feel stressed out. But she wanted to feel like she was doing something. I don't know if anybody on this program has had that experience. They want to feel like they're doing something. But know that if you're calling 3 or 4 times a week or once a week or whatever makes sense for your relationship, it may be enough. Maybe boost it a little bit if there's more health or mental health issues going on, or if something's happening that you really need to talk to them. But again, don't feel like if your loved one won't participate in those FaceTime or Zoom or Skype, don't feel like it's a failure. Sometimes they'd rather just do a phone call. It's funny because a lot of us are having Zoom fatigue. And sometimes I've had colleagues say to me, can we please not do a Zoom? I just don't feel like wearing makeup today. I just don't feel like doing my hair. I just don't feel like getting ready for a Zoom call. Absolutely. So don't underestimate the power of a phone call. So again, we talked about, again, based on your risk tolerance, doing a socially distanced walk, doing an outside visit. In some families, maybe the risk of maybe Darlene.
Jen, you're back. You locked up a little bit.
Okay, I want to make sure everybody can hear me again. Okay, so the in real life visits and gatherings, maybe everyone's been vaccinated, maybe you're ready to be together as a group, but everyone has to, we do know the data says that, especially if people haven't been vaccinated, that being outside is safer. But and I know that especially in the mid-Atlantic, our geographic area can be tough this time of year, but we've got a nice day today. Today might be a great day to do an outdoor visit. And I know that an outdoor visit, you want to be able to lounge inside. For a lot of people, that's not going to make sense right now. So you have to figure out what makes sense with you and your loved one's risk tolerance. But again, doing a walk, doing something, maybe investing in lamps to have on your porch or have on your outside area might be a great way to do that, or having a fire pit. That's been one of the really nice silver linings during this time, is seeing the creative ways people are figuring out how to gather with their older loved ones. So another one that I think can be really good, not just for the older loved one, but also for you, is right now is volunteer match. So maybe for some of you, there's a space in your life because maybe you were always taking care of your loved one. You were always at their house. They live a couple hours away and you were there once a week, or you were flying in to help take care of them several times a year, and there's now a gap in your life. And caregiving takes up a lot of energy and takes up a lot of space in our lives. And maybe your loved one has moved to a senior living community, or maybe they have help in the home now. Maybe because of what's going on with pandemic and COVID policy, you have a space in your life, and volunteer match is a great way to fill that space. And so I've always recommended volunteermatch.org for a long time, because if you want to volunteer, it's a great clearinghouse. So with your skills and your interests, you can be matched up with an organization that could use your services. And for a long time, it was based on geography. What do you enjoy doing? Do you enjoy knitting? Do you enjoy tutoring kids? But now they have a whole database of virtual volunteer opportunities based, again, on what organizations need, but also on what your skills are. And it doesn't figure in for geography. So just really thinking about if there's a space in your life, or if your loved one is bored, or maybe for that person who shared that their loved one was really depressed, this might be a way to get them feeling like they can give back and that they have a role. So I want to ask everybody, if prior to March 2020, how often did you visit your loved one prior to March 2020? And we've got a question about volunteer match, about the age for volunteering. Just go to their site, and I don't think that they have any age limitations. There might be some where you have to be over 18, but just go to their website and they'll show you. So before COVID policy and the pandemic took over our lives, how often did you visit? Okay, so some people weekly and then other. Nobody said monthly, nobody said annually. So what I want everybody to be challenged to do, if whether you're a true long distance caregiver that you live a plane ride away or a long car ride away, or if you're sort of a long distance caregiver now because of visitation policies at maybe a senior living community, or because you don't want to be in the same proximity with your loved one because of concerns about COVID, I want you to be honest. Are you putting pressure on yourself, even though maybe you would have only visited 3 times a year, and maybe you saw your loved one once last year? But some people, maybe you really did only see them weekly, and now it's just bugging you because you're being told you shouldn't see them often or you can't see them often. So sometimes it helps to sort of reframe that and say, listen, under normal circumstances, would I really be seeing them that much more? And that can really help to put things in perspective, because I know so many of you right now, you're struggling with guilt. I should be doing more. Caregivers tend to be very, very hard on themselves. So just really be thinking, if the COVID policies and issues weren't occurring, would I really be seeing my loved one even more? And that's like the example I gave about my colleague that was calling her mom 3 and 4 times a day. She was doing that because she felt helpless. She felt like, I should be doing more. And this is a crazy situation. I should be doing more. I should go visit her. And really she wasn't really going to do that under normal circumstances. She wasn't doing anything different at that time. So some people are saying they're able to visit 2 and 3 times a week, which is terrific. So try not to be too hard on yourself. And again, when we talk about doing these in-person visits, it might be that if you are going to see each other in person, that you both get a COVID test, or the whole family gets a COVID test before you gather together, and talk to your doctor. Are there safe ways to give your mom a hug, or to see your family? Because again, while COVID is very contagious and there are a lot of, some people get very, very ill from it, most people, you can figure out ways, talk to your doctor, whether we get a COVID test, whether you're getting vaccinated, what are the best strategies for you based on your risk profile, based on your health and your loved one's health, and what makes sense for you and your family. And for some people, notes, cards, phone calls, Zoom, that's what's going to make the most sense for you. But for some people, it might be something else. So as far as community supports, this is again the time to be saying, all right, do we need to change the way we're doing everything? Is this still working for our families? So maybe if you live far away from your mom or your grandmother or your aunt, maybe working with a care manager makes more sense now. Maybe working with the Loudoun County Area Agency on Aging. And if your family member is in another state, all you have to do is go to n4a.org, and Darlene will put that in the chat section. Or I know that the Loudoun County Area Agency on Aging can help you figure out where the area agency for where your loved one resides. There is an area agency on aging in every single county or cluster of counties in the United States. Senior living, for some people, right now is the perfect time for a senior living move, especially you're going to get the vaccine. If that's something, looking at private duty, it's not without risk. Nothing is. There's no zero risk, but it might be what's right for you and your family right now. looking into automating some services, getting more products delivered. If you've never done medication delivery, maybe now is the time to do that. Maybe getting more services automated. And being flexible, adjusting expectations. And it's really, really important for everybody to just know that nobody's doing this perfectly right now. Nobody's been through this before. Everyone's struggling. Everyone's having a hard time. Don't let guilt or the shoulds get the best of you. You really want to remind yourself that if you are caregiving, you're doing more than a lot of other people out there are. And Leslie and I know Leslie, I'm sure she could tell you countless stories of people, older adults who have no family involvement, no friends involvement, nobody looking out for them. So whatever you are doing for your loved one, just remind yourself that you're doing the best that you can. If you are struggling, whether it's sleep, we had somebody talk about sleeps or more migraines or more heartburn, or you feel like you're having panic attacks more, talk to your doctor, consider talking to a psychotherapist. And I know this therapy online is not the same as in-person therapy. It's not. But for some people, it's going to help. And maybe it is for some people, taking some medicine might be the right thing. So talk to your doctor if you're struggling, and talk to them about what will be ways that you can cope right now for yourself and for your loved one. So feel free to write in any last comments or questions at all that you might have. And if we can answer them, we will. If you would like a free chapter in the worksheets from Cruising Through Caregiving, go to cruisingthroughcaregiving.com. And just one last thing, and I heard a lot of people when they wrote in their comments about their loved ones today, if your loved one has capacity and he or she can make their own decisions, you want to be persistent, you want to be patient to try to get them the help that they need, but they are still an adult. And thank you all for everything you are doing as a family caregiver. You're probably doing more than most people. We appreciate you, and feel free to write in any last comments or questions before we wrap up.
Great. Thank you, Jen. And thank you all for joining us. And a special thank you to Loudoun County Area Agency on Aging for sponsoring today's program. Now, on behalf of Loudoun County Area Agency on Aging, we would like to invite you to join us for our next virtual caregiver program, which is going to be on March 18, and the focus is going to be on taboo topics. Now, for information about upcoming programs, please visit loudoun.gov/AAA, and I'm putting that link into the chat so you can copy and paste that into your browser. We do appreciate you joining us today. I also put a link in there for a quick survey. If you could let us know what you thought about the program, that would be great. Otherwise, feel free to continue. If you have any additional questions, we're still monitoring the chat, so we'll get to those in the next moment or two. Thanks again for joining us. Hope that you have a wonderful day, and we'll look forward to seeing you again soon. Thanks so much. Take care.
And really, that survey is 30 seconds. If everyone would write in, we'd really appreciate it. And just let us know. Take you 30 seconds to do the survey. Enjoy the rest of the day, and thanks for attending.